the topic of epistaxis. So see here everyone, what is epistaxis? Bleeding from the nose is known as epistaxis. Now very important point, as you can see in this diagram. So first thing what you must have to remember, that most commonly it occurs in the anterior segment of the nose. Okay, so the anterior segment of the nose, it is the most common, that is the anterior epistaxis. So it is the most common due to the bleeding from the Kieselbeck plexus. So bleeding from the Kieselbeck plexus, that is the anterior segment bleeding of the nose. Okay, and please remember, but very important is your posterior epistaxis. Please remember, posterior epistaxis, the bleeding can be life threatening. Okay, so if the bleeding occurs from the posterior segment of the nose, it is a life threatening, and it is mainly due to this artery, that is the sphenopalatine artery, which is a branch of the maxillary artery. It is a branch of the maxillary artery. Now you must have to know the Kieselbeck plexus. So Kieselbeck plexus is formed by the ethmoidal arteries 1, greater palatine arteries 2, labial artery 3, and sphenopalatine artery 4. So for the Kieselbeck plexus, the mnemonic is legs. L is your labial artery, E is your anterior and posterior ethmoidal artery. Okay, G is your greater palatine artery, and S is your again sphenopalatine artery. Okay, sphenopalatine artery. So what are the common causes in relation to the epistaxis? Please remember, the common causes are: number 1, it can be foreign body, it can be trauma, it can be allergic rhinitis, and please remember, it can be nasal angiofibromas, mostly seen in young adolescent males. So please remember, whenever there is epistaxis, you have to pinch the nose. That is the first aid management. Pinch the nose and you ask the patient to tilt forward. Mostly what our people do, that they pinch the nose and tilt the head backwards. So this is wrong. Okay, so this is the proper technique. You have to pinch the nose and tilt forward to stop the bleeding in the patient. Okay, so this is your epistaxis, very important for your examination. Thank you.